Hello, my name is Linny Sargent. I'm a trainee art therapist and I'm here today to talk to you about person-centred art therapy for people with neurodivergence. My presentation will be broken down into 5 sections, starting with what is art therapy, followed by what is neurodivergence, then what is person-centred, art as a form of communication, and finishing with the therapeutic benefits of art. To begin with, what is art therapy? Art therapy is a form of psychotherapy that enables the user to communicate through creative activities such as drawing, painting, and model making. Engaging in art making can enable the user to express their feelings or emotional needs which may be confusing or distressing. Being good at art isn't a requirement, as art therapy focuses on the process rather than the finished product. I shall now explain what is meant by neurodivergence. The Oxford Dictionary defines it as a noun, meaning neurodivergence in mental or neurological function from what is considered typical. Neurodivergence can be congenital, such as learning differences, ASD, ADHD, although these can also be acquired. Other acquired neurodivergences include, but are not limited to, brain injury or illnesses affecting the brain. Acquired neurodegenerative diseases include, but are not limited to, dementia, Parkinson's disease. There can be many crossovers within neurodivergences and neurodiversities, and so it is not possible to exhaustively discuss this topic in a 10-minute presentation. A neurodivergence is never a mere insufficiency. There is always a need to restore, to replace, or to compensate for and preserve identity, and this is where art therapy can aid neuroplasticity. Neuroplasticity is the brain's ability to form and reorganize synaptic connections. I shall now discuss what is person-centred. Person-centred care is derived from Carl Rogers' client-centred therapy, where he makes his stance known on the benefits of the humanistic approach. How each of us perceives reality is unique, and we all experience the same occurrences differently, depending on upbringing and biological factors. But our own perception of these exact occurrences may also differ, depending on how we have faced previous challenges. We cannot assume that individuals will experience the same reality based on their history, or that they will react the same as previous reactions, and neither can we assume that reality is the same based on a diagnosis. How a diagnosis or label affects one person does not mean that another will be affected in the same way. Symptoms may appear the same, but individual thoughts and beliefs will always remain individual. A diagnosis does not take into account home life, early childhood, support networks, race, gender, age, religion, the list is endless. And so, a holistic approach is necessary, and seeing the individual past any labels for therapists to provide the best possible centred care. I will now discuss art as a form of communication. Throughout history, art has been used to express opinions of politics, religion, to highlight problems such as racism, personal views can be expressed on behalf of the masses to try and create a better world. From symbols and basic shapes to grand masterpieces, art has been widely used to communicate without relying on words. Today, art making, as well as the process, is still widely beneficial. It enables people to express themselves freely where words are not always possible, either due to neurodivergence, a disability, or trauma. Art therapy enables the subconscious to speak. Engaging in a meaningful activity can also reduce stress levels and offer the participant a sense of purpose, which in turn can boost self-confidence. This image illustrates how art therapy doesn't have to be traditional art making. Here, the individual was provided with the space to enjoy gardening, catered to her specific needs to increase her well-being using a person-centered holistic approach. We must see the individual as a whole, beyond labels. But also being mindful of any difficulties so that the therapist and client can work together with appropriate resources to enable the individual to get the most out of the sessions. If we look at Kipwood's flower, he proposes that when 5 basic needs are met, fulfillment is reached. The 5 needs are comfort, identity, occupation, inclusion, attachment. Having these needs met results in fulfillment. Kipwood's flower can only be maintained if the person is seen as an individual, as we all have very different ways as to how our specific needs are met, and even more so if someone has a neurodivergence. Neurodivergence can cause individuals to find effective communication difficult. This difficulty can present itself in the individual clamming up. Giving individuals the tools to communicate and our time to gain trust, individuals can open up and heal from difficulties caused by neurodivergence. Even if the individual has a degenerative condition, meaning that their verbal communication may decline with the progression of the disease, art therapy is still highly effective in enabling the individual to process their thoughts. It is important to focus on what an individual can do rather than what they cannot, and by catering to their capabilities, we can provide the best possible person-centered art therapy. So what are the therapeutic benefits of art? In the Art Therapy Sourcebook, Kathy Malchiodi states that through art therapy, people may find relief from overwhelming emotions, crises, or trauma. They may discover insights about themselves, increase their sense of well-being, enrich their daily lives through creative expression, or experience personal transformation. I believe that absolutely anyone can benefit from art therapy, and one doesn't have to be in a crisis to reap the advantages of art making to process emotions. Participating in art making gives the user a chance to slow down and process their thoughts in a safe and meaningful way. It can allow the participant to heal and boost self-esteem. If regular art therapy is available to individuals with neurodivergence, then I believe that their chances of becoming in a position to feel overwhelmed or hit crisis point is drastically reduced, especially if the art therapy is person-centered. Thank you for listening. If you have any questions, then please feel free to email me at hello@starling.co.uk. Thank you.